If you're over the age of 50 and taking a medication every single day that you believe is protecting your health, what I'm about to tell you might surprise you. Some older adults are unknowingly taking a drug that may quietly place extra strain on the heart while masking the warning signs until serious damage has already begun. And the most unsettling part is this: many people never connect their symptoms to the medication at all. Before we continue, take a moment to like this video and subscribe to the channel. I share medically grounded health insights designed to help you protect your heart, your brain, and your future before small warning signs become life-changing problems. Now, I want you to imagine something very common. You wake up feeling slightly more tired than usual. Maybe your ankles look a little swollen. Maybe climbing stairs suddenly feels harder than it did 6 months ago. You tell yourself it's just aging, maybe stress, maybe poor sleep. But in many cases, those subtle changes are the body whispering long before it starts screaming. I've seen this happen too many times. A patient comes into the office convinced they're simply getting older, only for us to discover that a medication they've been taking for years may be contributing to fluid retention, irregular heartbeat, rising blood pressure, or worsening heart strain. Not because the medication is bad for everyone, but because aging bodies process drugs differently than they did decades earlier. Most people don't realize that after age 60, the heart becomes more vulnerable to side effects that once seemed minor. The kidneys slow down, blood vessels stiffen. The body becomes more sensitive to inflammation, dehydration, and chemical imbalances. A drug that felt harmless at age 40 may affect the cardiovascular system very differently at age 70. And one category of medication keeps appearing in conversations among heart specialists because of how commonly it's used by older adults every single day: pain medications, especially certain anti-inflammatory drugs that many people take for arthritis, back pain, knee pain, or chronic aches. Some are prescription medications, others are sold over the counter and kept in kitchen drawers across the country. People assume that if something is available without a prescription, it must be completely safe for long-term use. Unfortunately, that assumption has led many older adults into dangerous territory without realizing it. Now, this does not mean everyone should stop taking their medication. That would be irresponsible. But it does mean people deserve to understand the hidden risks, especially when symptoms develop slowly and quietly over time. Because sometimes the first warning sign isn't chest pain. Sometimes it's exhaustion. Sometimes it's swelling. Sometimes it's simply feeling different. And by the time people recognize the connection, the heart has already been under pressure for years. One of the most dangerous things about heart-related medication side effects is how ordinary the symptoms can feel at first. That's what makes them so easy to dismiss. A little fatigue after lunch, mild shortness of breath while carrying groceries, shoes feeling tighter at the end of the day. Many older adults assume these are simply unavoidable parts of aging, but the body often gives clues long before a serious cardiac event occurs. What I'm about to tell you might surprise you. Certain anti-inflammatory pain medications, commonly known as NSAIDs, have been linked in multiple studies to increased cardiovascular strain in some individuals, especially older adults with high blood pressure, diabetes, kidney concerns, or existing heart disease. These medications may help reduce pain and inflammation, but they can also affect fluid balance, blood pressure regulation, and circulation in ways many people never expect. I've seen patients who took these drugs daily for years because they wanted to stay active. They wanted to garden, walk without pain, sleep through the night. Their intentions were understandable, but over time, some began experiencing symptoms they never connected to the medication itself. The heart is incredibly sensitive to excess fluid. When certain medications cause the body to retain sodium and water, the heart may be forced to work harder to pump effectively. In someone younger and otherwise healthy, the body may compensate. But in older adults, especially those already managing blood sugar issues or mild hypertension. That extra strain can gradually become significant. Most people don't realize that elevated blood pressure often develops silently. You may feel perfectly normal while damage slowly affects the blood vessels, kidneys, eyes, and heart muscle itself. Then one day, a person who thought they were fine suddenly experiences dizziness, chest tightness, or an irregular heartbeat that seems to come out of nowhere. But it rarely comes out of nowhere. The warning signs were usually there all along. And another concern many cardiac specialists discuss is how some pain medications may reduce blood flow to the kidneys. Why does that matter for the heart? Because the kidneys and heart function like partners. When kidney function becomes stressed, blood pressure regulation may worsen, fluid balance becomes harder to control, and cardiovascular risk can increase over time. This is especially important for adults with diabetes. High blood sugar already affects blood vessels and circulation. Add chronic inflammation, aging arteries, and medications that may influence fluid retention or kidney function, and the body can enter a cycle that slowly increases cardiovascular burden without obvious symptoms in the beginning. That's why awareness matters so much, not panic. Awareness. There's a major difference between using a medication carefully under medical supervision and unknowingly depending on it every day without regular evaluation. Many older adults continue medications for years without ever discussing whether their body still tolerates them the same way it once did. And perhaps the most concerning part is this. Some people believe that if pain decreases, the body must be healthier. But pain relief and long-term health are not always the same thing. Sometimes symptoms become quieter while underlying strain continues building in silence. I remember speaking with a man in his late 60s who told me something I'll never forget. He said, "Doctor, I thought I was doing everything right. He walked every morning. He avoided smoking. He tried to eat reasonably well. But he had severe knee pain. And for nearly 7 years, he relied heavily on over-the-counter anti-inflammatory medication just to get through the day. At first, nothing seemed wrong. Then small changes began appearing so gradually that he barely noticed them. He became winded more easily. His blood pressure crept upward. He started waking up during the night feeling uncomfortable lying flat. His ankles swelled slightly in the evenings. He assumed it was simply part of getting older. What I'm about to tell you might surprise you. Many people associate heart trouble only with dramatic symptoms like crushing chest pain, but especially in older adults, heart strain can appear in much quieter ways. Fatigue, brain fog, reduced stamina, swelling, poor sleep. A strange feeling that your body just doesn't recover the way it used to. The body often whispers before it screams, and this is where many people unknowingly place themselves at risk. They continue taking medications that may temporarily improve comfort while ignoring the subtle warning signs developing underneath. Now, to be very clear, these medications absolutely have legitimate medical uses. For some people, they are appropriate and helpful when used carefully and under supervision. The concern comes from long-term, frequent, or unnecessary use without understanding how age changes the body's tolerance. Most people don't realize that as we age, the lining of blood vessels becomes more vulnerable to inflammation and stiffness. The heart may already be working harder than it did decades earlier. Add chronic stress, blood sugar instability, poor sleep, dehydration, or excess sodium intake, and the cardiovascular system becomes far more sensitive to additional strain. Then something unexpected happens. A person who believed they were healthy enough suddenly develops heart rhythm issues, worsening hypertension, or signs of heart failure that seemed to appear out of nowhere. I've seen this happen too many times, and in many cases, the problem wasn't caused by a single dramatic event. It was the accumulation of small stressors over many years. One detail that often gets overlooked is dosage. Many older adults quietly increase how often they take pain medication because the original amount stops feeling effective. A tablet becomes 2. Only on bad days, slowly becomes every day. Eventually, the body adapts, while the cardiovascular system absorbs the consequences little by little. Another issue is medication stacking. Some people take prescription anti-inflammatory drugs while also using over-the-counter versions without realizing they belong to the same category. Others combine them with cold medications or decongestants that may further raise blood pressure. And because the symptoms build slowly, people rarely suspect the connection. That's why regular medication reviews become incredibly important after age 50, especially for anyone with diabetes, high blood pressure, kidney concerns, or a family history of heart disease. Sometimes the most dangerous health risks are not hidden in rare diseases. Sometimes they're sitting quietly inside the medicine cabinet. One of the biggest misconceptions I hear from older adults is this: if my doctor prescribed it years ago, it must still be safe for me now. And while that belief is understandable, the reality is more complicated than most people realize. Your body at 70 is not the same body you had at 45. Your metabolism changes. Your kidneys filter more slowly. Your liver processes medications differently. Even your hydration levels can shift more rapidly. What once caused little stress on the cardiovascular system may now place significantly greater strain on the heart and blood vessels. This is especially important because many adults over 60 are not taking just one medication. They're taking several. Blood pressure medications, blood sugar medications, cholesterol medications, sleep aids, pain relievers, acid reflux drugs. Sometimes these combinations interact in ways that gradually increase risk without producing immediate alarm bells. What I'm about to tell you might surprise you. Some older adults become trapped in a cycle where one medication contributes to symptoms that lead to another medication, which then creates additional side effects that affect the heart even further. For example, a person may take anti-inflammatory medication for chronic pain. Over time, blood pressure rises. A second medication is added to control the blood pressure. Fluid retention develops, fatigue increases, physical activity decreases, weight slowly rises, blood sugar becomes harder to control. Then the heart begins struggling under the combined pressure of inflammation, reduced circulation, and metabolic stress. And because this process unfolds slowly, people often normalize it. They say things like, "I'm just slowing down." But sometimes the body is not simply aging, sometimes it's overloaded. I've seen patients who believed they were losing stamina because they were getting older, when in reality, their cardiovascular system was under constant pressure from factors that had never been fully reassessed. Another overlooked danger is dehydration. Many pain medications may increase risk when older adults are not drinking enough fluids, especially during hot weather or illness. Dehydration can thicken the blood, affect kidney function, and make the heart work harder to maintain circulation. Add diabetes or high blood pressure to the equation, and the strain can become even more significant. And here's something many people never think about. Some symptoms blamed on aging may actually improve when medications are carefully reviewed with a healthcare professional. Not because a person becomes young again, but because the body is finally given a chance to function with less chemical stress and better balance. Most people don't realize how powerful prevention can be. Small adjustments made early may help support healthier blood pressure, circulation, sleep quality, energy levels, and cardiovascular function over time. That doesn't mean avoiding every medication. Modern medicine saves lives every day. The goal is not fear. The goal is informed awareness, because the people most at risk are often not reckless individuals ignoring their health. They're responsible adults trying to manage pain, remain independent, and continue living normal lives. And that's exactly why this conversation matters so much. There's another reason this issue becomes so dangerous for older adults, and it has very little to do with the medication itself. It has to do with silence. The heart can struggle quietly for years before a person experiences a major warning sign. That's what makes this so unsettling. Many people imagine heart problems arriving suddenly like a lightning strike. But in reality, cardiovascular decline is often gradual. The body adapts, it compensates. It finds ways to keep functioning even while pressure slowly builds beneath the surface. Until one day, it can't compensate anymore. What I'm about to tell you might surprise you. Some of the earliest clues that the heart is under stress don't even seem related to the heart at all. People notice reduced energy. They stop walking as far because they feel heavy. They nap more often. They feel mentally slower. Their shoes fit tighter by evening. They become short of breath while talking or climbing stairs. Many assume these are harmless inconveniences of aging, but sometimes they're signals that circulation, fluid balance, or cardiac efficiency is beginning to change. I've seen this happen too many times in patients who delayed getting evaluated because they didn't want to overreact. They convinced themselves it was nothing serious. Meanwhile, the body continued sending signals every single day, and one of the most concerning patterns among older adults is ignoring symptoms because pain medication temporarily improves comfort. A person feels better physically for a few hours, so they assume everything must be okay internally. But symptom relief does not always mean risk reduction. That distinction matters, especially for adults living with diabetes or prediabetes. High blood sugar can already affect nerves and circulation, which means some individuals may not feel warning signs as clearly as others. In some cases, people experience reduced sensation, unusual fatigue, or vague discomfort instead of obvious chest pain. That's why prevention and regular monitoring become incredibly important after age 50. Most people don't realize that lifestyle habits surrounding medication use also matter tremendously. Poor sleep increases stress hormones. Excess sodium worsens fluid retention. Low physical activity weakens circulation. Chronic stress affects blood pressure and inflammation. When these factors combine with medications that may already place strain on the cardiovascular system, the effects can slowly compound over time. Now here's the encouraging part. Small improvements often matter more than dramatic changes. Staying hydrated, reviewing medications regularly, walking consistently, improving sleep quality, reducing ultra-processed foods, monitoring blood pressure at home, paying attention to swelling or unusual fatigue. These habits may seem simple, but over time they can play a meaningful role in supporting cardiovascular health and helping people notice warning signs earlier. Because the goal is not perfection, the goal is awareness before a crisis develops. And the people who protect their hearts best are usually not the ones chasing miracle cures or extreme solutions. They're the individuals who respect the small signals their body has been trying to communicate all along. Sometimes the difference between stability and emergency begins with finally recognizing that those minor symptoms were never truly minor in the first place. One conversation I often have with older patients becomes deeply emotional because many of them eventually ask the same question. Why didn't anyone tell me this earlier? And the truth is, medicine can become incredibly focused on treating immediate symptoms while important long-term conversations sometimes get overlooked. A medication may successfully reduce pain, but if nobody regularly reevaluates how the aging body is responding, subtle cardiovascular strain can quietly continue in the background for years. Most people don't realize that heart health is rarely shaped by one single factor. It's usually the accumulation of many smaller influences over time. Blood sugar, sleep, stress, inflammation, hydration, weight, movement, medications, circulation. All of these systems interact with one another constantly. What I'm about to tell you might surprise you. In many cases, the heart begins struggling long before medical tests show dramatic abnormalities. A person may technically remain within range, while still experiencing declining cardiovascular resilience in everyday life. That's why listening to the body matters so much. If your stamina suddenly changes, pay attention. If swelling becomes more frequent, pay attention. If blood pressure readings begin creeping upward, pay attention. If simple tasks leave you unusually exhausted, don't dismiss it automatically as aging. I've seen this happen too many times where patients ignored small changes because they were afraid of discovering something serious. But avoiding information never protects the heart. Early awareness often creates the greatest opportunity for prevention and better long-term outcomes. And this is where careful conversations with healthcare providers become incredibly important. Many older adults never ask whether their current medications should still be used the same way they were 10 or 15 years ago. Sometimes dosages can be adjusted. Sometimes safer alternatives may exist for certain individuals. Sometimes physical therapy, weight reduction, improved sleep, gentle exercise, or anti-inflammatory dietary habits may help reduce reliance on frequent pain medication altogether. Not overnight. Not perfectly, but gradually. And even modest improvements in inflammation, mobility, and circulation can meaningfully support cardiovascular health over time. Another issue many people overlook is self-medicating during emotional stress. Some individuals increase pain medication use during periods of grief, loneliness, or depression because physical discomfort often worsens when emotional stress rises. The body carries emotional strain physically, especially in older adults, and chronic stress itself can affect blood pressure, sleep quality, blood sugar control, and heart rhythm. Everything is connected. That's why true prevention is never just about avoiding one specific drug or one unhealthy meal. It's about understanding how daily habits, medical conditions, emotional stress, and medications interact together inside an aging body. The good news is this: the body has an incredible ability to respond positively when given better support. People often feel empowered once they finally understand what their symptoms may be trying to tell them. Not doomed, not hopeless, empowered. Because many heart-related problems become far more manageable when caught earlier instead of later. And sometimes the first step toward protecting your future is simply recognizing that your body may have been asking for attention long before today. As a cardiac surgeon, I can tell you something that stays with me after all these years. The heart is remarkably resilient, but it is also incredibly honest. It responds to how we live, how we rest, how we eat, how we manage stress, and yes, how we use medications over time. The body keeps score quietly. What I'm about to tell you might surprise you. Some of the people who experience serious cardiovascular problems are not individuals who ignored their health completely. Many were responsible adults who simply never realized certain daily habits or medications were placing extra pressure on an aging heart. That's why awareness matters so much more than fear. Fear causes people to panic or avoid information. Awareness helps people make wiser decisions earlier. If you take regular pain medication, especially anti-inflammatory drugs, this is not a message to stop suddenly or become frightened. It's a reminder to ask important questions. Review your medications regularly. Monitor your blood pressure. Pay attention to swelling, unusual fatigue, shortness of breath, or reduced stamina. Have honest conversations with your healthcare provider about how your body has changed over the years. Most people don't realize that protecting the heart often begins with noticing the small shifts they've normalized for too long. The afternoon exhaustion, the dizziness when standing, the tighter shoes, the slower recovery after activity, the feeling that something just seems off. These signs deserve attention. I've seen this happen too many times where people waited for dramatic symptoms before taking action, only to discover the body had been warning them quietly for years. And unfortunately, by the time severe chest pain or a cardiac emergency occurs, the heart may already be under tremendous strain. But there is another side to this story that deserves hope. I've also seen people make small, consistent changes that significantly improved their quality of life. Better hydration, more movement, weight reduction, improved blood sugar control, better sleep habits, smarter medication management under medical supervision, regular monitoring instead of avoidance. Small actions repeated consistently can matter more than people think. The heart responds to support. And no matter your age, your body still benefits when you reduce unnecessary strain and begin paying closer attention to the signals it sends every day. So tonight, before you go to sleep, I want you to think about this honestly. Have you been ignoring symptoms because they seemed minor? Have you assumed exhaustion was just aging? Have you continued taking medications the same way for years without reevaluating them? Sometimes one conversation, one checkup, or one moment of awareness can change the direction of a person's future. And if this message helped you see your health differently, take a moment to subscribe, leave a comment, and share this video with someone you care about. Because the people we love most are often the ones quietly ignoring the warning signs until it becomes impossible to ignore them anymore. Your heart may be speaking more softly than you expected, but that doesn't mean it isn't trying to protect you.